a lot of doctors have informed us and our viewers that this getting active is not only after the surgery, but even before, getting ready for it. So let's talk about what a patient has to do before the surgery.
Sure. So physical therapy or any form of exercise, number one, can be preventative for arthritis. So it should be a big part of anyone's healthy lifestyle. But if you are planning or already have a surgery scheduled for hip or knee replacement, it is helpful to do something called pre-therapy. What it does is basically tries to strengthen up the quadriceps, hamstrings, abductors, hip flexors, all the muscles around your legs. And if we get you nice and strong prior to the surgery, it does seem to help patients get through the recovery period. If anything, it gives you a little bit of muscle memory so you know what you have to do next. I tell all my patients that it's a 50-50 situation we're in here. I can make you a promise that I will do everything possible to make sure the surgery, the postoperative period goes perfect. That being said, I can't do the physical therapy for you. I can't do the exercises for you. You have to do them yourself. If I could do it for you, I would, but I can't. And you have to do it yourself. You have to take that on, and attitude's everything when you're doing it.